Dear people in Hamburg, starting from the 28th of August till the 25th of September, the Corona Containment Ordinance applies in Hamburg. As always, we are providing the most important new regulations. There is a distinction between high-risk and virus variant areas. The decisive factor in determining whether an area is considered a high-risk area is how high the incidence of the coronavirus is or whether there is an increased risk of infection. A virus variant area is an area in which a coronavirus variant with varying characteristics has spread. This means that the vaccination or a previous infection with the coronavirus does not protect or provides limited protection against the variant. The introduction of the 3G access model and the 2G access model for certain events, gastronomy, sporting events, etc. is new. The 2G access model applies for now only in Hamburg. The organizer can choose one of the two access models. 3G means that only people who have either been fully vaccinated for all vaccines except Johnson & Johnson, that means twice, are recovered or tested get access. For the 3G model, the necessary restrictions apply as before, such as distance regulations, mask requirements, curfew, square meters of the area, or restrictions for the number of people. 2G means that only vaccinated or recovered persons have access. Some of the previous restrictions can be lifted if high protection standards are assured. These are guaranteed when only fully vaccinated and recovered people are present. This gives event branches, cultural institutions, leisure facilities, and restaurants the opportunity to offer services with eased regulations. The 2G model offers the possibility of dancing in clubs. The 2G option allows event organizers and guests to come together under less strict conditions. Distance rules no longer apply. Tables and rooms can be used to full capacity, and there is no more curfew. Anyone using the 2G model must ensure that when entering, people participating have a coronavirus vaccination certificate or proof of recovery, meaning proof that you already had corona. And it's important to check the identity card. People under the age of 18 must prove their age with ID. If you run a restaurant, are an organizer, or are providing services, you must notify your district office in advance that you only allow access to recovered and vaccinated people. The notification system is electronic via the website www.hamburg.de/2-G Zugangsmodell-Anzeige/. You may only run operations in the 2G access model when the notification is transmitted. The 2G rule offers the highest protection because the risk of infection is much lower when only vaccinated and convalescent people are present. People who are not vaccinated have a significantly higher risk of infection. A negative corona rapid test cannot exclude virus transmission. At religious events and funeral services, as well as fairs and exhibitions, one does not have to follow the strict regulations, such as distance, when the requirements of the 2G model are met during the event. That means there are only people on site who have a coronavirus vaccination certificate or have proof of recovery or are not yet 18 years of age. Dance events. The 3G model does not permit dance events in clubs and discotheques, indoor facilities in general. For outdoor dance events, the following strict requirements apply. The general hygiene requirements, a protection concept, the concept must be tested, and the contact details must be collected. A maximum of 250 people are allowed to participate. Dancing and 2G model. When only people who have a coronavirus vaccination certificate, a proof of recovery certificate, or those who are not yet 18 years old are present, there is no need to keep distance. A maximum of 750 people are allowed to take part in outdoor events and a maximum of 150 people in indoor spaces. Medical masks must be worn in indoor spaces. When guests are on their assigned standing or sitting places, they do not have to wear a mask. Group trips. Children and young people on kindergarten or school trips can be accommodated together. If there are other groups in the accommodation, distance must be kept. Sporting events and audience. When only people who have a coronavirus vaccination certificate, a proof of recovery certificate, or those who are not yet 18 years of age are present, there is no need to keep distance, 2G model. In enclosed spaces, a maximum of 1,300 people is permitted, otherwise a maximum of 2,000 participants are permitted. For running events, cycling races, or comparable non-stationary sporting competitions of non-contact sports, a maximum of 250 participants are allowed in outdoor public places. The general hygiene rules are to be respected and the contact details are to be collected. A maximum of 30 participants can start at the same time. A protection concept must be written and the athletes must register in advance. When only people who have a coronavirus vaccination certificate, a proof of recovery certificate, or those who are not yet 18 years of age are present, there is no need to keep distance and the maximum of participants is 750, 2G model. A higher number of participants can be applied for from the competent authority for sports. Education and training institutions, driving lessons. The general protective measures, hygiene, contact collection, mask requirement, etc. apply. During exams and lectures, participants do not have to wear masks. Study groups should not mix. Different study groups should not use rooms at the same time. The study groups may only be large enough so that everyone can keep the required distance. Offers may only take place indoors when participants have a negative coronavirus test. If lectures take place every day, 2 negative coronavirus tests are required for every week. Testing shall be carried out on 2 different days and there should be a day in between. Universities. In universities, the general rules of hygiene and distance must be assured. Universities write their own protection concept. A medical mask must be worn indoors whenever people move around freely. During lectures, there is no mask requirement. For offers in indoor spaces, one has to provide a negative coronavirus test, proof of vaccination, or proof of recovery. At state universities, teaching usually takes place on site. Teaching can also take place digitally. Hospitals. People with typical symptoms of the coronavirus or those dealing with a coronavirus infection are not permitted to enter. People coming from high-risk areas are only allowed to enter the hospital 10 days after entry. When entering from a virus variant area, people are not allowed to visit the hospital for 14 days after entry. People from high-risk areas are allowed to get tested earliest 5 days after entry. With a negative test result, they could then enter the hospital. People from virus variant areas are allowed to enter the hospital earlier when the area is considered as high risk while entering Germany and they have been tested negative. Vaccinated people from a virus variant area are allowed to enter the hospital with a negative test result if the vaccine is effective against the virus variant. Information from the Robert Koch Institute. People entering the hospital have to follow the general hygiene rules and must be informed about the application. Pastors are allowed to visit patients anytime. A distance of 1.5 meters must be kept during all visits. The facilities are allowed to limit the number of visitors to 1 person and to limit the visit to an hour. That's a lot of information. For everyone, it is a time of constant learning. It is important that we all look out for one another. Take care of yourself and others.